Hello students, welcome to our next video of the lymphatic system and immunity, what it is and how it works. Mr. Manee is going to make his grand appearance. Now within this video, Manee is going to help at some point kind of talk about immunity, but he is not a fighter. Manatees are more lovers. They're friends to everybody. So we're going to be looking at later on in the demonstration of how a white blood cell, which is a leukocyte, of how it actually does the job of attacking, and also how it does the job of immunity, giving us immunity. So we're going to be looking at that here in a few minutes. But let's remember a little bit about the cardiovascular system. Okay, so in some prior videos, the last two, they talk about the heart and how it's pumping blood around the body. Now, it is important when you think of the cardiovascular system, think of the heart, but think of the heart's job is to pump fluids around the body. Now, at some point, some of that fluid is going to go into a different vessel, and those vessels will be called the lymphatic vessels or the lymphatic system. So transportation, we know, is the big job of the cardiovascular system. The same thing applies to the lymphatic system, okay, is exchanging substances between the blood vessels in each individual cell. Okay, now those capillary beds that I would have talked about in the last video are very important because that's where we're going to pick up this lymphatic vessel system to bring the blood back to the heart, but deviating. Okay, so view it like a kind of like a there's a roadblock and you may need to take a detour to get around it, but the body has a unique way of all of these things that we eat and all these substances that we consume. If there is viruses, waste obviously that's left over, a separate bypass to bypass and to help to filter that portion of the liquids in our body before it goes back to the heart around again. Very important to be thinking back to the cardiovascular system of a special vein that I would have talked about called the subclavian. Okay, so think about your clavicles or where that's located. The subclavian vein is where these vessels are going to flow back in. So this very special system of the lymphatic system we have everywhere. Okay, so it's special tissue, and if you think back to what tissue is a group of cells working together for a purpose. Now this particular chapter is going to focus on mostly the leukocytes, okay, which are our white blood cells. So we're going to talk a little bit about the granulocytes, the phils, okay, so we think of neutrophils, eosinophils, and basophils. That's going to be some general protection. And then the two big ones we're going to focus on a lot on the second half of this video is going to deal with immunity. Okay, so immunity is going to deal with our lymphocytes, hence this chapter, and our monocytes. Okay, those are the A granulars. Okay, so when you think of the grand phils, think of the three granulars, and then the two lymphocytes and monocytes is what we're mostly going to be focusing on the majority of this chapter. So when you think about tissue throughout our body, we've got areas, we have openings. Okay, so you think of openings here, openings down there, and anywhere we have an openings is just a way, unfortunately, for bad things, pathogens to get into our body. So we have some lines of defense in those particular areas, but we also have it throughout our whole body, these special leukocytes that are going to fight for us. Okay, and that's where, of course, Manee, you're not going to play a role into that because you manatees love, but they're very curious. Okay, just like our leukocytes are very curious about things that are in our body, other cells, or even the cells within our body normally, of whether they're going to be friend or they're going to be foe. Okay, that's going to be the job of the leukocytes. There are going to be some main functions, 3 of them to be exact, of the lymphatic system. You definitely need to know those. So the first one is fluid balance. Okay, so you think about all these fluids, all these liquids we have in our body. So as we're circulating that blood, we get to the capillaries. That's where the exchanging is going to happen between the cells and the vessel. Okay, that's where you're going to find water, a lot of water, because you think about what our plasma, most of it is water, and all those dissolved substances need to exchange. They need to either go to a cell or come from a cell. Okay, and that's an area called the interstitial fluid. Okay, so the interstitial fluid is the fluid around the cell. It's the matrix. Okay, and I would have talked about matrix, you know, in prior videos, talking about the liquid that bathes literally the cells that they live in. So view it like a fish living in a fish tank. Okay, so obviously you want the water to be clean and pure and the pH to be correct, but the part of this system is going to help to kind of cleanse and clean up our fish tank, okay, that the cells are going to live in. So you think about the equal volume, remember we need homeostasis, of fluid that must be outside the cell and fluid that must be inside the cell. Now in future videos I want to get a little bit more into like the balance, okay, but always know that fluid either lives high numbers on the outside of the cell or high number inside of the cell as far as what is in that liquid. Now the second function of the immune system is one of the most important ones, which is protection. So when I say the word protection, I'm referring to immunity. Now later on in this video we'll talk about the particular cells called lymphocytes that are leukocytes, so they're white blood cells that are going to help to fight things off in our body. Now, unfortunately, you'll see when I get to the T cells and B cells, I can't use the manatees, okay? Sorry, baby manatee, mama manatee, even though I would think that mama manatee would turn into a mama bear, but they don't, to protect their young. But with that said, we think about fighting, okay? Fighting to keep us alive is the job of these lymphocytes. So those group of lymphocytes live and multiply throughout this system. So when you hear me say lymphoid tissue, that is referring to lymphocytes, white blood cells as a whole, but mostly about I think 70 to 80% is kind of the numbers you see in most textbooks of these big fighters that are going to fight off pathogens that are trying to attack our body. So they're going to destroy, they're going to do filtration, they're going to help to remove hopefully some cancer cells before that they reproduce in our body, and they're found also within the humors, these fluids within our body. So not only do they live within the tissue, again cells, they also live in the liquids that go around the cell to help to protect our body. And then lastly, the third type of function that the lymphatic system does as a whole is absorbing fats. Now in later videos I will get to this more intensely, but within our digestive system we have of course mechanically digesting and chemically digesting that we're going to look at. Now precisely one part of our small intestine is all about absorbing the foods. So you think about if we're absorbing the foods into our blood supply, then it can make our blood supply susceptible to pathogens, okay? And that's what we're going to look at eventually in digestion when we talk about the lacteal system, which is a part of the capillaries within our small intestines that's going to help to pull out excess fluids, okay? And if we drink too much water or eat too much food, but it's also going to pull those pathogens hopefully into the lymphatic vessels so that the lymphocytes, okay, can help to attack and break down these pathogens before it gets deeper within our body. So the lacteal system is where we're going to use, again, where the fats are going to be taken in and absorbed. And one thing we'll eventually add into that picture will be the liver. Part of the liver is going to secrete a liquid called bile that's going to help to break down the fats. Okay, but obviously we got to get it into the blood supply and to the right organ for that job to occur. So those are the three functions of the lymphatic system. Now it's important to understand is where is this lymph coming from to begin with? So what is this special liquid that is very similar to the interstitial fluid? It is coming from our blood, okay? So obviously if we have a capillary bed there that has blood flowing in it, we're going to have blood that is going to be seeping out into this bypass, okay, this extra filter system. So it is clear, it's a clear liquid. It resembles plasma. Some differences from it though, it has a lot less protein, but it still has some protein coming from our plasma. So it's comprised of water. So remember plasma is over 90% water, has those electrolytes, okay, so think about things that are in our blood anyway, sodiums, potassiums, all that fun stuff, all the waste, okay, but some of those proteins are leaking out into this particular capillary bed, okay, and has been absorbed into a separate duct system to slowly head back to the heart. Okay, now remember, we don't want 4 to 6 liters of our blood. Okay, when we think about that number of blood, when we talked about blood before, think about how many millions of red blood cells live in that. There should be no red blood cells inside of our lymph. Okay, that's important because of the size of the molecule. So definitely when you're thinking about the lymphatic system of things leaking into it, okay, or getting into it, important to understand that the size of the molecules, and red blood cells are very big compared to our smaller guys of obviously our white blood cells, even our platelets, okay, themselves as far as the size. So we should not have red blood cells within our clear plasma part that, again, the separating of it, we're looking for more the plasma itself. Now this tissue fluid is once it gets inside of the lymphatic vessel, that's where it officially changed the name into lymph. So it originally came from our interstitial, our stestium, which is that fluid that bathes our cells. Okay, but remember the larger molecules, larger proteins cannot get into this. Almost like draining spaghetti noodles, and you have a sifter, obviously, to do that. And when you're draining out, all the water will go out, but then of course the spaghetti, unless those holes are too big. We understand what lymph is, okay, so remember lymph is coming from our blood plasma. Now we need to understand the circulation. So the circulation begins at a capillary bed, and if you remember anything about the cardiovascular system, is we have capillaries, so arterioles, arteries, arterioles, capillaries, and then venules and veins. So the liquid that didn't go to the venules and veins then is going to go through a system of vessels that are called the lymphatic vessels. So remember, just like the blood capillaries, the lymphatic vessels are not going to have names that we have to worry about. Okay, but we have arteries, arterioles, capillaries, venules, and veins. In the lymphatic system, we start at the capillaries, and then capillaries to a vessel, to two main duct systems. Okay, tube systems that bring us back then to a vein that we're going to be looking at. So the names of those are going to be the following: right lymphatic duct and thoracic duct. So capillaries, lymphatic vessels, okay, or veins, large size. We don't have to worry about naming those. Then we go to the largest, which is going to be the thoracic duct and the right lymphatic duct. Okay, so thoracic duct should be the left, but they call it thoracic. And then we have a right lymphatic duct. Now, when we start at the capillaries, when we think about the lymphatic capillaries, the walls resemble those of the blood capillaries, okay, that they have that layer of very flattened, just squamous epithelial tissue that is allow the gaps in between the epithelial cells, is going to allow, of course, that fluid to flow in and the fluid to flow out, which is the interstitial fluid. Now it enters the lymphatic capillaries through the gaps, okay, and of course remember, as our blood is pumping, there's pressure inside those vessels, and that's of course going to help to allow that liquid to seep out through the process. Of course we think of diffusion, but also filtration. Okay, remember filtration, diffusion are the same, except for in filtration side we're adding pressure. Okay, hydrostatic pressure, of course, in our body would be the heart pumping, okay, adding pressure to those vessel walls. So remember the gradients, okay, remember from a high to low, okay, the same applies. So as the interstitial fluid enters the lymphatic capillaries, those gaps, then that increase is going to go down the pressure gradient, okay, so remember from a high number to a low number, okay, and that's going to, of course, that volume, that excess fluid, so we have more fluid over here than here, high to low number, okay, is going to go inside of those capillary systems. Now, wherever it is at, okay, remember the capillary beds, they're throughout the whole body, okay, there's not just like one main one here and one main there, just like unfortunately in a lot of textbooks shows us. So wherever it was started, then it's going to take its job back one way, back to the heart. Okay, so if it started in my hand is where that it was pushed out and got into those capillary beds, and it's going to take its pathway back for the heart, back to the main giant lymphatic duct system. So the lymphatic vessels, so capillaries, lymphatic vessels, they're very thin walled, remember. Okay, that's important. Also, when we talk about these vessels, they're very delicate, okay. And there's valves in them very similar to our veins that allow and prevent, okay, allow things to go forward, but also preventing those valves as they close off, preventing backflow. Okay, so that's why when you have a lot of fluid that entered the capillaries into the lymphatic vessels, that's why you can have edema in the area sometimes if the system is backed up. Okay, so like putting a stopper in your sink and all that water starts to pile up. Okay, so the lymphatic system also is much slower. It does not have a main pump. Okay, it's something important to be thinking about, just like our veins in our body. But our veins, remember, also have the heart pressure. Okay, this is outside of that heart pressure. Okay, that's why we don't pick up, when we're measuring an artery, okay, for blood pressure. We're not measuring a vein or a lymphatic vessel, okay, due to that fact. Very low pressure. So the capillaries collect that interstitial fluid, that excess fluid, okay, then it goes into a little bit larger vessel, and then after that it's going to go to the two main duct systems, okay, aka the left, okay, which is the thoracic duct, okay, and on the left side of the body, and that is going to drain 75% of all of the excess fluid, that lymph within our body, on its way back to the heart. Okay, 75%. So you'll see within the videos the parts that I want to show you that is going to drain into the lymphatic duct. Okay, so the left side of the face, the left thorax, all the abdominal area, both legs, okay, and the left side of your arm, okay, the left arm, all of that's going to drain into the thoracic duct. Then that's what's left over is the right side. Okay, so the right side would be the right arm, a little bit of the right thorax, the right side of the face. That's all that's going to drain into the right lymphatic duct. So again, think about anywhere along the passageway, and again, wherever it comes out, okay, it meets the lymphatic capillaries, and it's going to take that journey through different vessels until it gets to the main duct system to get back to the heart. So the thoracic and the right lymphatic duct, those biggest of the vessels in our lymphatic system, both meet and merge back into the veins, the left and the right subclavian vein. So thoracic duct drains into the left subclavian vein. Okay, remember that initially hooks up to the vena cava, to the right atrium, and the right side connects up to the right subclavian vein back to, of course, the vena cava, back to the heart. And you're going to see that within the demonstration here in a minute. Now remember that lymph moving, there are no main pump, okay? There is no main pump. It is going to be skeletal muscles every time you move. When we breathe, that's going to change our respiratory. And also within the vessels, there's going to be smooth muscles that's going to have a rhythm type of action that is going to help propel that lymph back to the main vessels that will connect back up to our heart. So very important. Capillaries, vessels, lymphatic. Then they get to the biggest, the two largest would be left and right, okay, thoracic and right lymphatic. That eventually then is pushing it back to the subclavian veins, back to the vena cava, back to the right atrium of our heart. Earlier in the video, I would have talked about the flow from the arteries to the capillaries. And then at the capillary beds is where we will find the lymphatic capillaries. The bigger molecules that do not continue on will be funneled into the lymphatic vessels. And then in those lymphatic vessels from the capillaries, we will pick up to the following. Now, as you can see, that there is the blue that's relating to the vein, and then the green is relating to the lymphatic vessels. Now, it's very important, no matter where, again, remember those capillary beds, wherever there is a capillary bed, in the arms and the thorax and the legs and the head, wherever there is a capillary bed, there is going to be two different vessels. One vessel is going to be the circulatory, that's going to bring it back to the heart through the veins, and the other capillary beds are going to be the lymphatic vessels. Now, once it enters into the capillaries and gets into the vessels, then it's going to flow all the way back to the heart. But it's going to flow through a different type of vessel. Now, those lymphatic vessels are as such, and you notice that they run parallel to the veins within our body. So again, where you find the capillary beds, you're going to find veins, and you're going to find lymphatic vessels, and those will be parallel. Okay, so definitely think about parallel parking. Very important to understand what is flowing into the right lymphatic duct. So the right lymphatic duct is going to be the following areas: all of the right arm, the right thorax, and the right side of the face. So that is the only thing. The right side of the face would drain from top to bottom. Obviously the arms then are going to drain from your fingers all the way up your arms. And then of course the thorax region would kind of go this kind of direction. Now what happens from all of that lymph that is in that right lymphatic duct? It is going to drain into the right subclavian vein. So again, the right lymphatic duct is going to drain into the right subclavian vein. And then that vein then connects up to the vena cava, to the right atrium. Now the left side is going to be a little bit different. Now let's look at that. So the left side is called the thoracic duct, and it's the largest. 75% of all the lymph in our body flows through this duct system. These are lymphatic vessels. So let's look at the areas that the thoracic duct is going to drain. All of your legs, both sides. So all of our legs, both sides. Then it's going to also drain all the rest of our thorax region. So all of this, just not that right side, but all the rest of it. Your left arm and the left side of your face. So the left side of your face is going to drain down from the top. Then, of course, the legs would drain up the legs, both sides now. All of that thorax region, all of that left arm drains up, and then it's going to connect up then to the left subclavian vein. So the thoracic duct drains back to the circulatory system, the left subclavian vein. Then that, of course, connects to the vena cava, which connects to the right atrium. So similarities between our right lymphatic duct and thoracic duct is both of those drain up, no matter where they started. They will end at the right side goes to the right, and the left side goes to the left, both at the subclavian vein. So when you see these names, remember, these are blood vessels. These names are going to be lymphatic vessels. Very important. Now, along that journey, we have these things called lymph nodes. Okay, you're going to see the lymph nodes within the demonstration, but lymph nodes are going to be these areas that is going to filter blood. View it like a recycling center. Okay, and there are clusters along the passageway of these lymphatic vessels. Their primary functions, of course, is fending infections in our body through white blood cell formation. Okay, now there's over 600 of them throughout our body. We have more than just areas of openings. Most of them are small, about the size of a pin. Okay, and you have larger ones, obviously, in clusters in our body, about the size of a lima bean. Now, definitely important to be thinking about the clusters, okay, because if you know where the clusters are at, okay, that would kind of tell you when we're thinking about infections within our body. Now, the clusters are going to be as such, okay. Cervical would be the head, okay, located in the neck, deep and very superficial. So we have them on various parts of our head and neck. They often become enlarged during we have upper respiratory. So when we think of lymph nodes, we think of those, okay. Now, the next cluster is the axillary armpit, okay, areas. They usually become enlarged in infections, of course, not only upper body, but we think of upper extremities and also within the breast tissue. So this is an area that they look for with breast cancers, of spreading of cancer throughout our body. Now the other ones, we think of the trachea, bronchial regions. Okay, those are of course near the trachea region and the bronchial tubes inside of our lungs. You think about these lymph nodes then are becoming inflamed, getting larger when we're getting toxins, dust, smoke, okay, within those areas. And the last two are the mesenteric. Okay, the mesenteric refers to the intestines. Okay, so and again, we have anywhere from 100 to 150 just in the mesenteric region. And then lastly, the inguinal, there's the other opening, okay, the groin area. It receives lymph drainage from the lower extremities. It also, we think about the external reproductive organs. Now, when these lymph nodes become enlarged, usually they're showing, again, we have an infection, okay, that has entered the body through the openings in our inguinal area. When you're looking at the lymph nodes, you'll definitely notice there is more vessels going into these lymph nodes and fewer leaving. Okay, then of course connecting back up to the that network system. So think of traffic. If you have lots of lanes of traffic, let's say 6 lanes coming in and you go down to 2, obviously the traffic's going to back up, and it allows within inside these lymph nodes. We have leukocytes doing munch, eating, and you're definitely going to see the importance of, that swelling is showing that there's a lot more activity that's happening within those nodes from the white blood cells doing phagocytosis.
Now, it's very important to understand, no matter if we're talking about the thoracic duct or if we're talking about the right lymphatic duct, all along the way you're going to find these lymph nodes that are going to process like a recycling center, and that's where white blood cells are going to live. Here in a few minutes, I'm going to talk more in detail about these lymph nodes. So the right lymphatic duct, remember, drains both the legs, most of the thorax abdominal area, except for the right side part of it. Then it drains the left arm and the left side of the head. Now again, all that vessel then, all along the way you're going to find lymph nodes. Eventually then it's going to connect up to the left subclavian vein and go back to the vena cava to go back to the heart. And then remember, on the right side, it's going to drain the right side of my head, part of the right side of my thorax, and just my right arm. So those areas then drain, and all along the way, remember, there's going to be lymph nodes. That side then is eventually going to drain into our right subclavian vein, goes back to the vena cava, back to the right atrium. Now, either from the right lymphatic duct or the thoracic duct, that's the left side, all along the way, and that passageway back from those capillaries, right before those would be the lymphatic capillaries going into these vessels, all along the way you're going to find these lymph nodes. Now there are, over 600 of these lymph nodes throughout our body. Most of them are about the size of the tip of an ink pen, so think how tiny that is. They're throughout your body. Now again, they do come in clusters, and I would have mentioned that during the prior part of this recording, talking about obviously cervical, the neck region, and so on. But in those lymph nodes, you're going to find white blood cells. And remember, the job of a white blood cell is to do phagocytosis. So there is lymphoid tissue that lives inside. So when I say the word lymphoid tissue, that is referring to a place. Cells, and those type of cells that live there mostly, are going to be white blood cells. If you notice, there is a couple different passageways. And again, this would be directly connected to the lymph node. So that would be the either right or thoracic lymphatic duct. And they connect up, and it's a big, giant again, passageway. Okay, so on that route back to the heart, there will be a lot more entrances versus exits. Okay, you notice there's only 2 on this side and there's 3 on this side. So think about traffic, how traffic backs up. If you have more traffic coming in and then you have lesser lanes going out, obviously it's going to cause things to back up within the lymph node. That recycling center with the white blood cells is then going to hopefully destroy things and get rid of things in our body that could harm us. And then that liquid then is going to leave, and then of course eventually it's going to go back to the subclavian vein, and then that's going to bring it back to the heart. So we will go through many, okay, who even knows, maybe hundreds, depending upon what area of the body, that is going to go through these lymph nodes, and it's going to process, and those white blood cells are going to do phagocytosis.
So that's the first type of organ. Okay, it's an organ system. Okay, when we're thinking about within the lymphatic system, we have some main organs. The lymph node is the first one. Now tonsils we're going to look at next, then our thymus, then our spleen. Okay, now when you're thinking about lymph nodes, that is directly connected to the lymphatic vessels. These other ones are going to be outside tissue, lymphoid tissue, that will eventually drain into the lymphatic system through those capillaries. Okay, that is important to be thinking about. So let's talk about the spleen, Mr. Spleen. Okay, the spleen, we think of a couple different functions outside of when we think of white blood cells. So the spleen itself is very highly vascular. So the spleen is going to filter our blood, okay, much like the lymph nodes are going to help to filter the lymph. Now, where is it located is important. It's superior, okay. It's in the hypochondriac region, okay. So we think about the left side, the highest of our region, so the upper quadrant, but if you get really precise, it's in the hypochondriac region of the abdomen. It is under the dome of the diaphragm, okay, so very, very high. And it's normally kind of protected by the lower portions of our rib cage, okay, because of its job. The spleen itself is very kind of small. It's only 5 to 6 inches, okay, 2 to 3 inches wide, and it is very elastic, okay, so it can expand a little bit more than actually our lymph nodes can. Now, it's involuntary as far as the muscle aspect, so that's why it can have a little bit of swelling to it because of the elasticity. Now, the job mostly of the lymphatic system is going to be 3 things. Now, the first one is it stores as a reservoir our blood. Okay, so our red blood cells are actually helping to filter the blood, and by doing that, we actually have those red blood cells that are being stored within our spleen. So that way, if, again, if we had an accident or if our red blood cell count is low, the spleen can actually add the red blood cells to our body. Now, the other 2 things that it does for the red blood cells, and even platelets, is it promotes red blood cells before we're even born. Okay, so the spleen is part of the embryonic stage of development, of where the spleen is going to actually help to, through a process of called the erythropoiesin, is going to help to promote red blood cell production within our body as an embryo. Now, the last that deals with the red blood cells is going to be helping to cleanse through storing and getting rid of the waste that comes from our red blood cells when they die. So destroying old red blood cells that are worn out, it breaks down the iron and those other byproducts of hemoglobin, and then is going to carry that to the liver. That way the body can reuse it or eliminate it when it is through getting what it needs. Now, there's just a little part of the pulp. Okay. When you look at the red pulp of our spleen, that relates to the job of the red blood cells, okay, as far as what it's going to do with the red blood cells. The white pulp has lymphocytes that are going to do the job of helping to cleanse the blood also as it's filtering through the spleen.
Now, the next organ is going to be the spleen. Now, Mr. Spleen is a good name to call it. Okay, now it is located within the left upper quadrant. And again, I've put this on the outside. Obviously, it would be below the ribs, but you can't see it, so that way it kind of helps if you see it for you. Now, Spleen, Mr. Spleen. Now, the spleen does a lot more with the red blood cells than it does with the white blood cells. But there is some lymphoid tissue that lives, some white blood cells that live in the spleen that help to clean our blood by doing phagocytosis. The rest of the jobs of the spleen is not dealing with white blood cells, it's doing with red blood cells. So 3 main things you need to know about the spleen when it comes to red blood cells is it stores blood. Second, it's going to make blood before we're born. That process is called erythropoiesis. And then lastly, it's going to help to recycle the dying and dead red blood cells so our body can reuse the parts for other processes. So Mr. Spleen, definitely know it as a part of the lymphatic system. It is an organ, mostly because it does have lymphocytes, lymphoid tissue that lives within it.
Now the next part is the thymus. Okay, the thymus is in the superior thorax region. Okay, it's below the sternum. It's deep to the sternum. It's going to help the immune system because it's going to help with T cells, okay, T lymphocytes. Okay, it helps to mature, so it's a lot like a college. Okay, it's going to help to train these special fighters that I'll talk about later within this video. As we age, after puberty, the tissue that undergoes changes. It actually shrinks and slowly becomes connective tissue. Loose connective tissue, better known as adipose. Okay, so literally by the time we get in our 70s, sometimes in your 60s, but usually 70s, definitely in the 80s, it's actually college has closed up shop, and now it's just a piece of fat kind of hanging in our body and does not help to train or give us much immunity protection.
So the next organ is the thymus, and the thymus is located within the mediastinum region. Okay, so within this region. Now the thymus is very important because up to puberty age, it's going to have and train special cells called our T cells. And I'll be talking about those later on in our video, but T lymphocytes, okay, this is like the college that's going to train them. Now the funny thing about this is once we hit puberty, the size of it's going to start to shrink. And when you get to between 65 and above, this is actually going to turn into adipose tissue and is going to become almost useless. That's why our immunity as we age goes down. So definitely know what the thymus does. It's like a college that's going to train our T cells.
Now the tonsils, very important. Okay, and again, you're going to see that within the demonstration of important to see that how the tonsils work. The tonsils are masses of lymphoid tissue. Okay, of course, the major opening. They help provide protection against any, when we eat things or inhale things. Okay, that important job of giving us the first line of defense. There are lymphocytes, okay, that live within this tissue that attack those pathogens and do phagocytosis. Now, like the spleen and the thymus, the tonsils are not directly connected to the lymphatic vessel network, okay? So they're extra lymphocytes, lymphoid tissue that's going to help to do phagocytosis, and of course, eventually going to send that excess fluid into the capillaries, and then at that particular bed, where there's a lymphatic capillary, they're going to pick up that excess waste, and then, of course, do its processing again through the lymph nodes, and then eventually, of course, get back to the heart. Definitely know the 3 different types. Okay, there are 3 names and where they're located at. The first one is the palatine. Okay, so you think of the palates. Okay, the soft palates. Okay, so these are ones we look in your throat. We think of those are the true tonsils when you look back. Number 2 are the pharyngetical. Those are the ones when you look up. Okay, they're sometimes called the adenoids. Okay, these are the tonsils that are behind the nose. Okay, in the upper part of our throat, our pharynx. And the last one is your lingual tonsils, which are the little mounds when you look back that are at the posterior part of our tongue.
Now, the next organs are a group of tonsils. Now, tonsils are masses of lymphoid tissue that are located in the vicinity of our throat. And actually, the first one there at the top has the same name as our throat, which is the pharynx. The purpose of these, they house lymphoid tissue, lymphocytes, aka white blood cells, to attack pathogens. Just like the spleen and the thymus, they are not connected with the lymphatic vessel network. So definitely important. I didn't mention that earlier with the spleen and thymus. The tonsils also are not connected to those vessels that we talked about earlier. They're a separate area that eventually, of course, will protect when things go by and did not get into the lymphatic vessels. So let's look at the 3 different tonsils that we have and where they're located at. Now the first one I put here is the pharyngenical tonsils, also known aka as your adenoids. Now the adenoids are located behind the nose, hence why I put them up high, on the posterior wall of your upper throat. Okay, so because if you remember when you're reading in your book, definitely understand that the pharynx is going to be the throat, the medical name for it. We have 2 different regions of our throat. So think about when you wear a mask, that would be the throat region. Okay, behind your nose, behind your mouth, and then behind right where your chin, the bottom of your chin, where your vocal cords would be, that's your pharynx region. Now the second group, and again, you only have one of those, just one tonsil. A group of tonsils next is called the palatines. Okay, so think about within your mouth, the palates. Okay, this is where they're going to be located at. They're at the side of your soft, kind of the gaggy part inside of your palates. And this is what sometimes we refer to as the tonsil. So when you look at the back of your mouth, these are going to be the tonsils that you're going to see. And then last but not least, another group of tonsils called your lingual. Lingual stands for these little mounds at the back of your posterior portion of your tongue. Okay, so these are of course going to help as we eat things. Okay, we breathe in things. Okay, so the tonsils again have lymphatic, have white blood cells that live within them. And of course, definitely think about ones that are removed. It would be these 2. Not very often they would remove the lingual tonsils. Okay, so if they remove your adenoids, it would be this one. If they remove the true tonsils, it's going to be this one.
So now that you've watched the demonstrations, I want to remind you about some disorders that would affect this system. Okay, so any type of disorder related to infection, remember you would see the word pathy. Okay, so remember pathy is relating to disease. So of course the lymphadenopathy would be the relationship of a disease of the lymph nodes themselves. Okay, if you see an itis, would be an inflammation of the lymph nodes. So remember, anytime you have swollen glands and there's not an infection happening in those, could point to certain itises that could be caused by a virus. Okay, so when you think about mono, definitely think about that's a virus that is causing inflammation within the lymphatic system, more precisely at the lymph nodes. Now we think of lymphedema. Lymphedema, again, edema is tissue swelling due to excess fluid. But edema itself could also be coming from an obstruction of the flow of the lymph through the lymphatic vessels. So we think of conditions such as elephantitis. That would be, of course, we have huge swelling. And again, it depends which of those vessels is blocked. Obviously, when you think about the left side of the body, there's a lot more drainage that's happening back to the heart versus the right side of the body. Okay, think about all that lymph and flow that needs to occur. Now within this system, of course, we think of leukemias. We think of the lymphoid, lymphoma. So lymphoma is, of course, a cancer related to the white blood cells that inhabit the system. So those B cells and T cells, and even another cell called natural killer cells. Non-Hodgkin's and Hodgkin's lymphoma. So Hodgkin's lymphoma relates to cancers of the B cells and the lymphatic system, okay, especially the lymph nodes. We think of B cells. You're going to be hearing me talk about it here in a minute. That is the one that is directly related to making the antibodies, okay. So we think about this one ranges anywhere from age 20 to about age 65. And again, they still don't know exactly what causes Hodgkin's lymphoma, but in most cases there is a viral infection that kind of started the problem, and the disease itself then, of course, is characterized by an enlarging of the lymph nodes or close to where the group and cluster of lymph nodes is. Now, non-Hodgkin's lymphoma is more common, and it is the one that's characterized usually in older adults, and usually patients of any age that have a deficient immune system. Cases, of course, when we think of HIV, we think of AIDS. That is associated sometimes with non-Hodgkin's lymphoma. Of course, again, enlarging of the lymph nodes can be a sign, especially when you think about the cervical region. It is, in many cases, of where it's more widespread throughout the system than Hodgkin's disease, and can spread more easily to other tissues such as the liver. So they definitely will be looking at the liver and liver problems with it. So definitely when you think about just the anatomy part of the lymphatic system, definitely going to need to know a few things. Definitely know what lymph is, okay? Lymph, again, is that clear liquid, does not have red blood cells in it, okay, because those are larger proteins, so larger molecules that we do not need in the lymph itself. It starts off in a capillary bed, okay, and then the excess fluid then will move on through various lymph nodes as it is traveling through the various types of vessels, and along that pathway then as it's getting filtered, then it's got a choice of two different directions it will go. If it's that left side of the body, majority of it, including your right leg, which I know is kind of weird, is going to be the thoracic duct, and then on the right side, okay, not including your right leg, it's going to be the right lymphatic duct. Both of those again eventually drain back to the subclavian vein and then back to the right atrium through the vena cava. Now, the next part of this video that you're going to see is going to relate directly to immunity. Okay, so how the immune system works, and that name course is your innate and adaptive immunity, okay, itself. Now, when you think about things attacking our body, definitely immunity is the defense mechanism. Okay, so think about, you know, bacteria and viruses, okay, and fungi, okay, all of these microorganisms, even the good ones that turn bad, okay, and are trying to hurt us, called pathogens, okay. So any type of defense mechanism that protects us against these bad guys, okay, these microorganisms, pathogens, is what we talk about when we talk about immunity. Now, immunity can work two different ways. Now, we have two different types of immunity that we have within our body. We have one that we're born with called the innate, okay, defense mechanisms, which are mostly the fills. Okay, when we look at the leukocytes, remember leukocytes is what we're talking about. On the other side of that is the adaptive specific immunity. Okay, so this one's general, non-specific. It's not trained by any may. It just does what it needs to do, good or bad. Okay, it's just protecting, hopefully preventing things from getting past the first line and second line of defense. The adaptive immunity is the trained fighters. Okay, we'll talk about those here in detail. And I'll have, of course, a demonstration to show you what is going on with that. So how do these infections happen in our body? Okay, so remember what an infection is all those signs and symptoms coming together that shows us that something is trying to attack our body. Now, it could be outside of the body, those port of entry, okay, such as obviously the openings we have, or it could be already within our body, just waiting to attack. Okay, remember when good cells go bad, okay, definitely thinking of that way. Now, innate immunity. So what is innate immunity? Okay, so it's a line of defense, and there's two lines of defenses. So view it like a castle. Okay, so the people on the outside are trying to break into the castle to steal the things that are in the castle. I want as many lines of defense that I can before it breaches the wall and gets inside of my castle. Now, innate defenses are a first and second line of defense. Now, these innate, the word innate literally means you're born with. And genetics, yes, does play a role into this. Okay, and that's why, you know, there's a lot of immune therapies we're studying and research to figure out how can we strengthen somebody's innate defenses, as first and second line of defenses, before that bad pathogen sets up shop and starts reproducing in our body and takes over our body. But since genetics play a role into that, unfortunately with this system, we'll very quickly see that we don't know how well our innate and even adaptive immunity is going to work until it's challenged itself. So there are barriers, okay, and metabolic responses. Okay, they'll think of chemicals that are going to protect us, hopefully, against these foreign invaders and harmful substances. Now, the responses themselves are very fast for the most part, okay, not precise by any means, but help to either prevent or slow down those infections. Now, the adaptive that we're going to look at here in a minute also can be very fast, okay, but the difference between it only develops after the exposure to a particular pathogen and are very precisely trained just to affect and destroy that pathogen. Adaptive defenses are kind of slower initially to emerge, but can completely eliminate a pathogen from the body and even prevent future infections that we see. So let's look at the first line of defense. So the first line of defense is going to be our mechanical barriers. Okay, so think of your skin, mucosal membranes. Okay, now also with that, we think about, okay, if I break the skin, then things can get in. If I get past the skin, then I get to that mucosis. Remember those membranes that line the passageways that have openings to the inside of us, okay, those are breached, then that's going to allow a pathogen to get into our body, get deeper through the tissue layers. Now, chemical barriers are going to be such as like acid in your stomach would be an example of a chemical barrier that's going to help to, prevent and fight off infections. So sweating could be an example of that. Acids in our stomach, these enzymes that we have, other chemicals that help to destroy the invaders. Digestive juices are really good at that particular one. So we have that barrier, we have some chemicals, okay, and then lastly we have certain reflexes, okay, they're going to aid in the removal of pathogens. So think about when you get something in your nose and you sneeze or you cough, okay, that's going to help to remove that matter from our body that's foreign. Vomiting and diarrhea are also reflexes of these ways that if we ingested something into our digestive system, toxins or bacteria that's there, we can get it out either way. Okay, so that is what they call the first line of defense, okay, innate barriers, and then innate barriers also could be chemicals, okay, or reflexes, okay, so that's your first line of defense. Definitely need to know the three main ways under the first line of defense, okay, mechanical, chemical, and reflexes. Now, let's say that a pathogen gets past, okay, we tried sneezing and sneezing and sneezing, but it didn't leave our body, okay, fast enough, and then it has to go deeper into our tissue level, and then that would be when the second line of defense is going to set up shop. And that second line of defense under the non-specific, again, this is still innate, okay, still things that you're born with, is going to be some activities that will hopefully destroy, okay, or limit how much that pathogen can attack our body. So there are 5 different innate cells and chemicals under the second line of defense that you need to know. So the first one is the process of phagocytosis. Okay, remember white blood cells, then they take in and destroy the waste. It could be even a cancer cell. Of course, that's obviously a pathogen. We think of the phils. Okay, so neutrophils are very important when we think about that first of our phils. This is the one that is going to do phagocytosis. Okay, it's the most numerous of our granulocytes, and it's going to go around and help to defend. Now, number 2 under the processes is natural killer cells. The name sounds pretty bad, okay, when you think about it, okay. This natural killer cell is a type of lymphocyte, but it is not like the active trainers that we'll be looking at here in a minute under T cells and B cells. This particular one has different receptors that kind of troll around our body, okay, looking for stuff that shouldn't be there. And if they find that, then they can do direct killing, okay, but they don't decipher between friend or foe. Okay, so that sometimes, unfortunately, those natural killer cells, these are the ones that like to live inside of our lymph nodes. our spleen, even our bone marrow and blood. They like to look for cells they don't recognize and destroy them by secreting a substance that can help to break down the cell itself. Okay, so they're not, again, they're not directly trained like our T cells of knowing friend from foe, but they can be a helpful beginner T cell that will help to give us a little bit of defense, okay, before the big guys have to step in. Now the next process is called the cytokines or non-cytokine chemicals. Okay, now a cytokine is a peptide, okay, that is produced by one of those immune cells or another body cell to kind of as a signal, like a white flag. And again, these cytokines come from sometimes those phagocytosis, the ingesting and releasing a liquid that tells other cells around that there's a problem with this group of tissue and that the fighters, the T cells, need to come destroy the area. Now we know the non-cytokines, okay, cytokines, we know the non-cytokines when we have problems such as the eosinophils and the basophils, when we think about itchy skin, okay, that word of histamine, okay, so histamine itself is going to be released from those types of granular cells. That's going to cause dilation of arterioles. And that's, of course, going to cause, of course, you think of the itchiness, okay, that we get throughout our membranes of our body, but that also causes that redness and swelling because it's opening up those arterioles, again, those arteries, to allow more blood flow to go to that area, and also those capillaries to become a little bit more leaky. Now, when that happens, that's going to cause those cells to do more phagocytosis. And of course, you think about if you get more of these white blood cells eating, there's going to be more waste product. And of course, that's going to build up that excess liquid, that tissue fluid that our lymphatic system is going to pick up. Now, the next way that our body does this second line of defense is through inflammation. Okay, we've talked a lot about this itises, but what is inflammation? It's non-specific. Remember, we're born with this type of immune response. When any type of cell, tissues, are damaged or irritated. Okay, examples, we think of friction. Okay, we think of extreme temperatures like hot and cold, or even allergens that can cause an inflammation. And all it is an irritant that is usually caused by an infection, okay, an infection itself. Now, when we think about inflammation, we think of heat, redness, swelling, and usually pain. Okay, that is going to occur within that area. So anytime you have tissue damage, pathogens then activate these cells called mast cells, which are the basophil-like immune cells in the tissues. Okay, so remember, all different tissues, you're going to have these white blood cells around them. That's what's going to produce that histamine. Okay, and then we have, of course, that dilating, the widening of our arterioles. Okay, and then, of course, it makes the capillaries more leaky. Okay, that's why you usually have like liquid, that pus kind of solution around a cut. As the blood plasma leaks out into the vessels of the tissue, then we think about, of course, blood clotting is going to occur because the vessel itself has been damaged, okay, and that hopefully will prevent spreading of the infection to other areas. And that's where sometimes you get, of course, that redness and that heat from the body temperature changing within that area. Now, pathogens itself, again, when we have the mixture of those white blood cells and fluids, that's where we're going to start seeing that pus, okay? And of course, that pressure then pushes on the nerve endings, and that's where the pain is going to come from. So inflammation is not a bad thing per se, but definitely when we think about inflammation as far as chronic inflammation is where tissues are being damaged. Obviously, cells are being killed in high numbers within that region. Now, the last type of second line of defense is going to be fever. Okay, now fever, remember, is that negative feedback loop. Okay, again, it's going to reset our homeostasis in our body. So if our temperature is normally 96 to 99, that's our average. By that pathogen being destroyed by some of our fills, that's going to, of course, release some of that liquid that is going to be like a white flag and say, hey, and it's going to reset our hypothalamus us to say, okay, I need the new temperature to cook and prevent these pathogens from reproducing in our body to 99 to, let's say, 103, 104, okay, depending on the foe that your body is facing. The misconception when we think about fever is that it's dangerous, that it should be stopped immediately isn't always true. Okay, controlling the fever itself does little to alter the course of the illness. Okay, so obviously we need to understand what caused the fever to begin with. Okay, because it could be a possible sign of a serious condition or disorder, and should recognize that increased metabolic rate may have adverse effects on a patient that has a weak heart. Okay, so there is some reason, obviously, with fever, certain ages, that we need to be more aware of what fever is, but a fever itself actually helps to boost the immune system initially. Okay. It stimulates the phagocytosis, tells the white blood cells they need to eat more. It actually speeds up our metabolism, but it decreases most diseases the ability for them to reproduce. So fever, in the most part, is good, but we have to obviously understand the pathogens that the body has faced. Of course, also we have to understand the problems, pre-existing conditions that our patient that has the fever is presenting. Now, we've talked about the first line of defense, the second line of defense, which are innate. Okay, so remember, both of those lines of defenses are the innate and born with responses. The last one, the third defense mechanism, is called adaptive or specific immunity. Okay, so when you hear adaptive specific immunity, we're no longer talking about the fills. Now we're talking about the A granulars, lymphocytes precisely. Okay, so definitely when you're thinking about adaptive, think about it has to be trained in order to change. So adaptive immunity is the final line of defense. These are our big fighters, our B cells, B lymphocytes, and T cells, T lymphocytes. Now, adaptive immunity to any type of disease is defined as the individual's power to either resist or overcome the effects of a particular disease. So we have to be exposed to these diseases either naturally, artificially, in order for our B cells and T cells to be trained. Now, both of these adaptive immunity can also be called acquired immunity. Okay, later on here in a little bit, I'm going to talk more about acquired immunity, but acquired immunity comes from, again, either from mom giving us passive immunity when we lived in her, and then when we were breastfeeding, or when we got the disease, okay, or we were given a vaccine to help our body build up immunity to it. Now, most of this acquired immunity is developed, of course, inside of mom throughout our lifetime, okay, when we are exposed to various elements, okay, harmful agents. Of course, we think about pathogens with it. So our immune system is kind of a check and balance system. For the most part, we're going to look at what an antigen is here in a second. I will define that and give you a little bit of definition with that. But an antigen is going to be just one part that's going to help our body to fight off these invaders. Now, some of this adaptive immunity can also come from these natural killer cells, and those cells, remember, first line and second line of defense, that can tell our T cells and B cells some information. And of course, that's something you're going to see here in a few minutes within the second half of this video. A couple words that I'll be talking about within this next part of the video is antigens and antibodies. Okay, so when you see the word antigen, definitely know that an antigen is any type of substance that induces an immune response. Okay, so antigen, okay, it could be those little markers, such as in our red blood cells or various cells that will change. Okay, and a lot of the viruses, hence why we have to get updated vaccinations. Or it could be something we consume. Okay, so think about, even the food. So if you have an allergen to peanuts, or if you have an allergen to milk, sometimes that could be then classified as the antigen that's causing your white blood cells to attack. So antigen is on something, okay, some type of molecule. Now, an antibody is an immunoglobulin or globulin, and that is going to be the response that is given by the B cells. Okay, so the B lymphocytes to give our body memory to keep if we're ever exposed to that particular antigen again. Okay, that's important. You got to understand the difference between an antigen and an antibody and who it's coming from.
Antigen is defined as anything that a substance that induces an immune response. So now we've talked about antigens before when we talked about the blood. Remember the red blood cells? And I did a couple different types of cells for us to look at. So this is a red blood cell, this is a white blood cell, and this is a pathogen. Okay, now, you remember we talked about that word of antigens when it related to red blood cells. There were markers, or the lack of markers, on the outside of our red blood cells that told our white blood cells whether they're a friend or they're a foe. Such in this case, you notice that they're the same color. So when the white blood cell is flowing through our body, or a red blood cell comes in contact with a lymphocyte, okay, white blood cell that is stationary, not moving, and bumps into it, if it recognizes, notice they're the same color, then it's going to be like, okay, you're a friend, I'm not going to attack you. Okay, now, what happens when things are foreign within our body? So let's say that one of those markers was on the red blood cell and I'll take one off here so you can see. So it had a different type of marker, and the white blood cell is floating along and sees it, and boom, it's like, oh, I do not like you. It's going to attack it, and it's going to cause that process that we talked about with the blood of agglutination. So it's going to kind of round it up, or it's also going to cause it to do hemolysis. Okay, remember that bursting of the red blood cells. And I would encourage you to refer back to the blood video if you're still struggling with what agglutination means, or hemolysis. But the same thing occurs with a white blood cell. Now, again, it recognized part of this pathogen, but it did not recognize the other marker. Same thing. It's going to clump it together, round it up, and then by doing that, it's going to cause an exploding. Okay, a lysis, okay, means to burst. Now, the outside, okay, these little markers in our white blood cell come from every time they destroy something in our body, they take a little piece of it and keep it so they have some memory of either obviously our blood cells or all of these different molecules that we're exposed to on a daily basis. And we'll talk here in a little bit of how immunity works.
Now, T cells you're going to hear about, and T cells are these terminators, okay? So both B cells and T cells come from think of bone marrow, okay? They come from stem cells, but the T cells actually travel to your thymus, and they're going to mature within your thymus. Okay, remember that mediastinum region I talked about in the first part of this video. That is going to be where they mature and they're going to learn. Okay, so 80% of the lymphocytes that are circulating from our body are going to be T cells. Okay, that have migrated, they're not mature, they go to the thymus and are learning through the things that we're exposed to. So they are called cell-mediated, okay, immunity. So they provide immunity to us through the different functions. Okay, the main function of a T cell is to terminate, okay, the pathogens that are trying to destroy our body. Okay, of course, when we think of the body, we think of the bad cells. Okay, now can T cells attack healthy cells? Yes. Okay, but for the most part, they are trying to save and keep us alive. Okay, now we're going to see, of course, within this next part of the video, what happens and how T cells work.
Now, what are T cells and what makes these T cell work? Now, T cells themselves are cells, again, that have gone to the thymus and they have matured there, and then they migrate and live in different lymphoid organs throughout our body. They are called cell-mediated immunity. So again, they're going to help to do direct attacking, like the Terminator, to the cells. Now, a T cell itself, there's going to be 4 different types I want to talk about. Now, all of these T cells cannot respond to an antigen directly. It must be told by a presenting cell. Now, these presenting cells do have different names. I'm not going to get into all the names, but these are, again, just large phagocytotic cells throughout our body, such as monocytes or even some lymphocytes that are going to ingest some of these antigens that our body presents. So, again, I want to use an example here of an antigen being the orange, okay, and then a white blood cell, monocyte or a macrophage, is just floating through the body, and they run into a foreign thing that they do not know. What they'll do is they'll actually will ingest, put the part, that antigen it did not recognize, actually on its surface. So then when it runs into another lymphocyte, that lymphocyte then is going to take that message, and through the process of learning, it is going to be activated. So remember, a T cell by itself cannot work unless another cell gives it the information. T cells do a response, an immunity called cell-mediated, where they directly attack the antigen directly. Now, there is a special way that this happens, and I have listed here for you 3 of the 4 different types of T lymphocytes involved in this process. There is another one, a 4th one, we'll talk about here in a few minutes. How do T cells terminate? Now remember, T cells are living mostly within the lymphoid tissue of our body. So an example I give, of course, would be the tonsils. So an allergen, it gets into your mouth, and it gets into the tonsil region, and it gets inside of that tissue. Now, there is an antigen presenting lymphocyte that is going to be helping to ingest through phagocytosis that antigen, and when it does that, it's going to leave some of that part of the antigen on its surface. So when that happens, that is actually then going to activate the first type of cell called a T cell. Now, a T cell itself is going to secrete a special liquid that is called cytokine. And cytokine is just pieces of that original antigen that it secretes. It's almost like it's peeing, okay? And that secretion then is going to activate the cytotoxin T cells. Now, the cytotoxin T cells that are now activated by that liquid that was released from our helper T cells is going to then produce memory cells. All of a sudden, we go from 1 to a lot of the cytotoxin cells, and these are the guys that are directly going to come up, and any pathogen that they see, they will come and overtake that antigen. Now, the sad part about these cytotoxin cells is as quickly as they destroyed what was invading the body, they will very quickly die. But some of those then are left and will be producing these cells called memory T cells. So once the invader has been destroyed, a majority of these white blood cells are going to be disappeared and destroyed in our body, and we're left with just a few of these memory cells. Just in case that antigen comes back, we at least have some immunity to do direct attacking. Now, through this activation process is going to then activate the B cells within our body. There is one more type of T cell that I want to mention, and that is the regulatory T cells. Now, the regulatory T cells are the ones that basically, instead of saying attack, they're the ones that put the stop sign out and tell the other cells, the memory cells, the cytotoxin cells, the helper T cells, to stop destroying cells in the body of that particular antigen. Remember, they are antigen precisely. So there are memory cell T cells within our body for a certain antigen where we're exposed to. There are cytotoxin T cells that were in response to a certain antigen, and there were helper T cells that have a response from a certain antigen.
Now that you've watched and learned about T cells, let's talk about B cells. Okay, B cells, or B lymphocytes, are the second main class of lymphocytes, okay, active during immunity. Now we think about T cells went to the thymus to mature. B cells mature in the red bone marrow. Okay, so they kind of stay put. They function in immunity by producing these Y-shaped proteins called antibodies, okay, also known as immunoglobulins or globulins, in response, remember, to something that they view as foreign, as far as the antigen. Okay, now like T cells, they have the surface receptors that bind to certain antigens. Okay, and the exposure to that antigen then stimulates the cell to, again, rapidly multiply, what you're getting ready to see, and produce some clones. Okay, and those clones then are going to produce those antibodies. Okay, so now watch the part of the video, the demonstration of how B cells work.
Now, unlike the T cells that are all about directly attacking the antigens, B cells are going to indirectly attack these antigens through the use of antibodies. So that is very, very important. Now, these type of cells produce the humoral immunity. Again, the fluids, the extracellular fluid that live within our body. That's where the antibodies are going to be carried by the blood and all that tissue fluid. Now, I talked about earlier with the T cells of how there was a helper T. Well, the helper T also helps activate our B cells. Now, the two different types of B cells we're going to have are going to be memory B cells and plasma B cells, which you notice a name of antibodies. So, remember earlier when the T cells secreted that liquid, okay, because of that antigen presenting cell came and bumped into it and said, hey, this is the message of how to destroy this particular antigen, and it activated that cytotoxin cell, T cell. Well, the helper T cells are also going to activate our B cells. Now, two things that can happen. Just like we had a memory cell that can live longer in our T cells, we also have some memory B cells that will live there and will stay in lower numbers. So if we're ever exposed to that antigen again, then it could produce a whole bunch of plasma cells. Now, these plasma B cells, that is what's going to make the antibodies. And these antibodies are just pieces and information that either are on the outside of the cell or floating through our body, our fluids of our body, or humors as they're called, that will again bind to and prevent a antigen from reproducing. So remember, as that antigen is flowing through our body, it has that marker, okay? And then that marker then is going to have a message that is presented on the outside of a antigen presenting cell. That antigen presenting cell then will make plasma B cells, and some of those then turn into memory cells, so then they can eventually make more of these plasma cells. Now, antibodies themselves, this is how antibodies work. Antibodies will destroy the antigens. They accomplish the task by attacking the antigens and indirectly activating a process of chemicals that will attack the antigens. So when an antibody reacts to that antigen directly, the antibodies then will bind to it. Okay, antibodies will come and surround that cell so it can no longer attach to the healthy cells of our body. Or it could also cause other white blood cells to join the picture and directly destroy that antigen. So it can attract T cells to come and directly attack that antigen, or it could cause that process of agglutination if there's multiple of these and clumping them together, and that course will lead to the process of lysis, which means to burst. And remember, Antibodies are very precise, okay? So an antibody for the flu will be different than an antibody that the body makes in response to a different type of virus or pathogen within our body. So remember, memory cells live in lower numbers throughout our body constantly. They live in the humors of our body. The T memory cells live mostly within the lymphoid tissues. Okay, so one's inside the cell, one is outside the cell.
So, B cells and T cells, okay, adaptive immunity. Now, how does that relate to how did I get that immunity to begin with? So we know how T cells work, we know how B cells work, but let's talk about the different ways that they are trained. They are trained through either naturally being exposed, okay, or getting natural immunity, or artificial. Okay, so let's talk about the natural side of it. Okay, natural immunity comes two different ways, passively and actively. Okay, that is important to know. So natural immunity that is passive always comes from mom. Okay, so we think about the cute little baby here, Manatee, that he will get some, it's very limited as far as the time frame, but some immunity from his mom, because when he was inside of mom, you were exchanging blood, so any type of immunity mom was getting, baby was also getting too. So that's natural passive immunity. So it's acquired, okay? When you see the word acquired, just think I'm getting it. Now the second type of natural immunity comes actively. So actively would be away from mom, okay? So natural active immunity is you actually getting the disease. So I get sick, I get the flu, my body's actively going to make antibodies in response to me getting that disease. So natural passive always comes from mom. Now I talked about being inside of mom, but remember once you're outside of mom, if you were lucky enough to get some breast milk from mom, that also has a passive immunity to it. Okay, so passive is always naturally is coming from mom, either inside of mom exchanging blood or outside of mom when you're breastfeeding. And again, it's very limited with the time frame, but it's better than nothing. It's helping to train at least our body a little bit. And then the other side of that is you away totally from mom. Okay, you're feeding yourself and you're getting the defense mechanism of natural active immunity comes from any time you get the disease. Okay, our body's actively making the antibodies that hopefully are going to protect us if we're ever exposed to it again. But again, remember with the foe of the antigens, okay, these pathogens, is we don't know how our body is going to respond until it is shown to us. Okay, that's the bad thing with some of these diseases that we obviously we think of COVID, is we did not know for a lot of us of how well our body was going to build up an immunity or overbuild immunity, okay, at that particular moment. So sometimes the signs and symptoms can be what kills us if the foe is too big. Okay, now natural comes from mom, natural comes from you getting the disease. The other side of that is artificial. So think about any type of shot is artificial. Okay, so artificial immunity comes from a vaccine or shot. Now, I'm not going to separate the differences between them, because a majority of the immunity that we get on the artificial side is going to be active. Okay, you get a shot, your body actively is exposed to that dead or weakened pathogen and learns to build up immunity to it. Okay, now there is some of that is kind of more short term, which is the passive side of artificial, and that would deal with such as like a rabies shot, even hepatitis B is where someone else has built up immunity. They took the antibodies from that person or thing and then gave it to you. So your body did not have to build up immunity. So when you think of active on either side, think of you have to build up immunity. Okay, passive always is somebody else has immunity and they're giving it to you passively. Okay, so natural comes from mom, or you getting the disease. Active, passive is going to be some type of shot on the artificial side. Okay, so definitely need to understand that. Now, can the body overreact? Yes, it can. Okay, so you kind of saw how the T cells and B cells work. Can they turn on us? Unfortunately. Okay, can they go into hyperdrive? Definitely can. Okay, so some names definitely be thinking about as far as overactivity could be an allergy. Okay, that is an unfavorable response to something that maybe your body's always been around, but all of a sudden it doesn't like it, so the white blood cells go into overdrive. Okay, but you definitely think of the severity of a hypersensitivity would be anaphylactic. Okay, so anaphylaxis. We think of that going into shock. I get stung by a bee. My body overreacts. Obviously airways close down. Not a good thing. Okay, so know what anaphylaxis is. Another way could be autoimmune diseases. That's just where an abnormal reaction to your own cells attacking. Arthritis could be an example of that. Of course, the joints getting attacked. Multiple sclerosis, and we think about the myelin sheath being attacked, and the list kind of goes on from there. Okay, so think about what autoimmune is. Okay, so the body is automatically responding, and it's going definitely too far with it. Now, we could have a deficiency of this system, and that's where one of the components, it could be part of the lymphatic system itself, one of the direct organs is failing. It could be one of the T cells became infected by a virus, okay, such as acquired immune deficiency syndrome is better known as AIDS. Okay, so HIV infected our T cells to a way of causing them to attack healthy cells within our body. We know now that we have a lot of different medicines and treatments that is helping to slow down and even stop some of these autoimmune diseases. Now, if you were to get an organ transplanted into your body, obviously if you were to gave an organ to someone, such as a kidney, the transferring of that organ or tissue from one person, the donor, to the recipient, we have to train the T cells, even those natural killer cells within our body, to not attack. Otherwise the immune system is going to destroy that healthy tissue that's been, because it views as foreign. So it's important to, of course, match up the antigens as far as the red blood cells. They also will give drugs that will suppress the immune system to basically kind of give it a chill pill to tell the white blood cells to not attack the healthy cells. And again, when we think about transplanting, that's when the body then will, hopefully through the use of B cells circulating, will prevent infections to the healthy cells by producing those antibodies to train the body of what is good and what is bad, friend or foe. But the body is always adapting and is trying to preserve homeostasis on a daily basis. So if nothing else, I've trained you to go to the sink and clean your hands on a daily basis to hopefully prevent us getting those antigens in our body. But the next time you're sick, definitely give thanks to our white blood cells for putting up a fight and hopefully keeping us alive to face another day and to go swim with a manatee. So I hope you have a great day, and I will see you within the next video. Stay healthy.